Hi, everyone. Welcome back to another episode of What Happens in Vegas. I'm your host, Dr. Stephanie Canestraro, and today we have a very special guest, Allie Chandler. We worked together in the past. She works with all the amazing practitioners and huge companies, helping them upsell their health and teaching practitioners how to really market better or sell themselves, match with patients now. You have your practitioner archetype, and soon you're going to have your patient archetype. So that's really important. Thanks so much for being here. We're going to talk a lot about our stories because me and you have very similar stories. So thank you. Thank you so much for being here.
Thank you for having me. I'm excited to be here.
I had a little problem with Wi-Fi, so I'm in a different spot than usual, but we're going to make it work because we've got really important information to share. Can you just start and tell people a little bit about yourself and how you got into this space? And then we'll jump into like 2021 and everything that we went through there, or 2022, whatever
Yeah,
it was.
absolutely. Yeah. So I got into this space because I got sick and I went to Europe. I went backpacking, must have gotten bitten by a tick. We were camping in Switzerland. And then the rest of the trip, I had just a whole bunch of symptoms. This was in 2015, and we'll probably get more into that later.
Mhm.
But I ended up finding a Lyme doctor eventually to work with to get me better. And then I ended up doing his marketing for him. Kind of got into the functional medicine marketing space because I needed to find someone to work with. It was very difficult, as you probably know too. And then, yeah, so I started working with Dr. Jay Davidson. I was his only, marketing person. I did high ticket sales for him. I kind of ran his clinic back end all while I was trying to heal from Lyme myself. And then from there, I was head of content when they created Cellcore Biosciences. So I worked with them for a while there. And then most recently, I was head of events and marketing at Microbiome Lab. So it's been an interesting journey of me kind of being sick with Lyme and mold and some other things we'll get into for about 10 years. But that's really why I got into this space, is because I needed to heal myself.
Yeah. So when we met, we were both pretty stable though, right? Like our symptoms were stable.
Yeah.
I hadn't had problems in like a decade. And I don't know how long it was for you, but
Yeah, probably a couple years. So I was pretty recently feeling a lot better. Yeah, we were both doing well at that time.
yeah. And then, I mean, suddenly had these huge shifts in our health at the same time. So that was like a clue for me that like weird stuff was
Mhm.
going on in the environment and that they were like the exact same symptoms. Like, so can you just kind of go
Yeah.
back to then and like, because you reached out to me and you were explaining your symptoms, I think because I had explained mine to you and then we were kind of like troubleshooting through our problems and
Mhm.
yeah.
Yeah. Yeah. So, yes, I really struggled with POTS. And that was one of my main issues when I figured out I had Lyme. And I ended up living in black mold in California too, which kind of caused another crash. But I did get better. I got more stable. I worked with a lot of amazing functional medicine doctors who put me on protocols to clear out parasites and heavy metals and, work on supporting drainage, which I know that's all of the same kinds of things you do with your patients too. It's really important. And so after that, I got COVID, and that really set me back to probably my worst point. Like I had been feeling a lot better for maybe 3 years. I was lifting weights, 5, 6 days a week. I was doing spinning classes. I really didn't have, I would say I was 95% better. I rarely had symptoms. And I know I haven't talked a whole lot about my story, but I was essentially bedbound for maybe a year and a half, just because every time I stood up, my heart rate would go from like 55 to 160, 165 just standing until I sat down again. So it was pretty severe. And walking, of course, it would go higher. But once I got COVID, it was like all of my symptoms I had kind of cleared and dealt with came back. And like I said, I was, head of events and marketing at Microbiome Labs, and it was a very stressful job. So we're traveling back and forth to Copenhagen. That's where our new headquarters globally was. I was on, calls all hours. We had leaderships and everything. And so the big thing that happened right after I got COVID, maybe a week or two after I had gotten cleared, I had to fly to Palm Springs for a meeting. And as soon as we got in the air on the plane, and I was flying like 20, 30 times a year with no real issues anymore. But as soon
Mhm.
as I got on the plane, my heart rate was just like 70, 180, 190 the entire flight, and it was skipping every other beat, and I just felt like I was going to pass out, and so on the plane, they had to put me on oxygen. They called, over the intercom to see if there were any doctors on board. So an ER doctor came and sat by me. He was so sweet. He actually turned on a hypnosis for me
Oh,
and had
wow.
me do a hypnosis. Like I said, they came out, put me on oxygen. They were going to land us in Arizona just because I had my watch on. So they were looking at my watch and my heart rate was just like all over, up and down. I think it got up to 220 at one point. But they ended up having fire trucks, ambulances, like everybody waiting on the tarmac for me because it was tough and I really didn't have issues with flying before that. But yeah, so then I did Palm Springs. I really felt pretty awful most of the time I was there. And then 2 weeks later, I was supposed to fly to Switzerland for another meeting. And the same thing happened. So I flew from Michigan, where I live, to DC, had the exact same experience in the plane. And it just was it was scary, of course, but it was so frustrating because I was like, my brain and like everything inside of me knows I can do this job, but I physically can't travel. And for such a like high level position where I'm having to take global meetings and fly all over the place and to trade shows, it was really, really tough. So I think that's why we connected because I think you were also having trouble flying, right?
Yeah, it all kind of started on a plane, or I guess exacerbated on a plane. But the thing with me is it was so much more ambiguous because I didn't actually get any symptoms of COVID. And now I learned about like people getting exposed to it and
Mhm.
fighting it off, but not really getting symptoms, but still getting like the long COVID or it turning on all of your old infections. So I hadn't had an issue ever with POTS like symptoms. Like when I first had Lyme, which I now look back and know it was Lyme because I was never diagnosed. I just treated parasites and all of that and cleaned up my lifestyle, found out I had celiac and my body had enough like organ reserve to get past it because I was in my early 20s. But this time, it went straight to my heart because back then it was if you looked at my symptoms, I had textbook neurological Lyme. But again, yours was like you were camping. Like I had nothing like that. It was like I did get bit by bed bugs though, which then I had to start researching can carry the disease. And that's kind of like when it turned on, but everything was so much more ambiguous. So I never really understood what was going on, even though I still, somehow got past the symptoms and I was fully stable. And then it was 2021, late 2021. I had never had COVID that I knew of. And I had been exposed to mold though at someone's cottage.
Mm.
And then I flew after that. And that was the first time my heart rate just went insane. Same thing as you, except I didn't have as good of luck with like having an ER doc. I had a drunk nurse as the person that was when they called on the thing. And she smelled like alcohol already. It was like 7 a.m. She told them I was having a panic attack. And I was like, I'm not having a panic attack. I've never had a panic attack. This is
Right.
physiological. I feel like I'm dying. My blood pressure was through the roof. I don't ever have a vein here. And it was like pulsating. My heart
Yeah.
rate was through the roof. And it was when everyone was scared to touch everyone. Everyone's like masked and wearing weird face guards. But luckily, this kind flight attendant came and was massaging the top of my shoulders. And that's what calmed my heart rate down for me to make it to Mexico. And then luckily, when I made it to Mexico, like Dr. Jabin was there and like other
Yeah.
people. And then I was fine after treatment for like a full year before it turned on again, like those symptoms. So it was just like, more ambiguous for me as like, what is happening? Like, what has turned on in my body?
Right.
So,
Yeah.
but
The blood
yeah,
pressure thing was a struggle too. It's almost like all these dysautonomia type symptoms where, and we maybe can talk about what you think it was in the body. Is it like a vagus nerve thing? It's a
mhm.
dysautonomia, like what's going on when that happens. But yeah, it's similar. There's a trigger, and then all of a sudden you're like back in and you had kind of new symptoms too.
Yeah, because it went to my heart this time and like having the dysautonomia, I didn't have that before. I had like pain all over my body in the past. I had Bell's palsy. I had like muscle fasciculations. I had like the pain in my organs, but not my heart in the past. And I didn't even realize I was having organ pain. I was in chiropractic college and we had learned about organ pain, but like my organ pain really turned on. So that was the first episode that happened on a plane. But then when I like a year later and did get exposed to COVID and did then get a wireless heart monitor put on me, I think it screwed up my immune system even more. So even more stealth infections came out that were hidden. And then I think it just stagnates your lymphatics and then they can't clear and then it toxifies your vagus nerve and then it leads to these crazy POTS like symptoms. You have this overflow of histamine, you have all these mast cells degranulating and just too much inflammation, but you're not clearing anything out. So it's like this kind of perfect storm from the way I treat these symptom patterns now. But obviously, COVID is a big part of these crazy symptoms.
Yeah, and I had the same experience where when I got back, I, of course, sort of went the conventional route because I was worried that maybe something structural was going on with my heart. So I went to a cardiologist. I did an echo, I did a stress test. We did, all of those kind of typical EKG. And then I also got, I think it is a month-long wireless monitor. And actually, they caught so many different palpitations and different
Yeah,
types of
terrible.
SVTs. There was like 8 options of things they could catch. I had all of them. They were like
Yeah,
triple, yeah. So it's interesting because part of me is like, right, having that like almost like the Wi-Fi, the EMF right over your heart for that long, did that actually make it worse?
it
Maybe.
it I okay,
Yeah.
so my body short-circuited the wireless monitor. It just burned it
I,
out. They were, like, pissed at me, but I felt insane when I put it on and, like, my hair was standing up on end, like, it was terrible. Like, I was electric. So, I definitely, on all of these podcasts, just, like, talk to people about just listening to your body because they were about to put the wireless heart monitor on me. I didn't really want it, but again, I was so scared like you. Yeah, so those wireless monitors are literally toxic. I suggest anyone, even the wired heart monitors, I've found give people symptoms, and I've been working with a lot of people with all of the heart stuff because of like my own symptoms. But I'll say whenever I see someone with these symptoms, they all have a not just one thing. There's usually mold and Lyme and something else, Babesia or some other co-infection because it's the dysregulation of your immune system that creates enough inflammation for these symptoms to happen.
that's right.
So
Absolutely.
what
And
was
I
the biggest sorry.
go ahead.
Go on. No, you go ahead.
I was just gonna say, I know for me, like I struggled with palpitations pretty severely for like a whole year after that. And
Yeah.
I would say, like, for anyone who struggled with POTS, it feels like you can't work out, right? Because you're just every time you stand, your heart rate is just absolutely terrible. But I actually found the more that I sat around with the heart conditions, like the worse my symptoms got. I would get really severe blood pooling in my legs where they would just turn bright purple. And I was like, I can't just sit in bed. Like I started doing bed yoga and I started just like lifting little weights again, just sitting. And I kind of like worked myself back up because I love lifting weights. It's one of my favorite things to do for stress relief or just kind of like, taking care of myself. And I do think that, stopping it and resting too much was also kind of bad for me. So it's just interesting to figure out how to build my body and my strength back up and just support like movement because it's really important.
It is very important. And it's funny you say that about the blood pooling in the legs because that same thing. My legs were going purple. I remember like we sent a picture back and forth to each other
Yep.
and it was just like terrible. The thing with me is because the when I had Lyme in the past, it attacked my joints and when it did that again, so that's what was stopping me from being able to so I had the heart stuff, which kind of felt better to me, same thing when I actually did something. But then I had like my neck would just seize because so much was in my cerebral spinal fluid that my whole spine would seize if I tried to do anything. And that was my biggest block for getting back to actually being able to work out, which has just been recently for me. So this is going on
Mm,
like 4 years, right? Like four
yeah.
full years of, but again, I am at that place, but it took like a pretty intense therapy for me to get over that last hump. So that's why I want to go into for you, like, what were some of the things that really moved the needle to stabilize you? You talked a little bit about the bed yoga and actually moving, but what other things like really helped you?
Yeah, so I actually, I did a whole bunch of different supplement protocols. I sort of revisited a lot of the ones I did originally just to kind of see, like, can I reduce my parasite load? So I did some of the cell core, para one, para two. I kind of did some light parasite cleansing, also drainage support. I know you talked about lymphatic flow being very important. So focused on like liver, lymph, colon, kind of the basics there. And then one thing that I also started was going back to my limbic system practice. So something that really helped me heal was a practice, like a DNRS or kind of doing EFT. There's a lot of different programs you can look into, Primal Trust, that help you just sort of like calm your nervous system and tell your body, like, look, these stressful, anxiety looking to the outside situations don't have to be like this. So I started seeing a new therapist and I started doing EMDR. So this was interesting. I mean, this wasn't the only thing that helped me, but I went back and started processing some medical traumas with my EMDR therapist because, for me, my entire marriage I was sick. So when I was in California, for 10 years, I was married to a PGA golf pro. The entire time, the whole 10 years, it was right after I got back from Europe. So I was sick my entire marriage. And it's actually part of why we ended up getting divorced is because our last apartment we moved into had pretty severe black mold. And that was just, I was so sick. I was going to the hospital all the time. I was going into anaphylaxis. I was having to be put on like IV steroids, IV Benadryl, fluids. There was like this whole protocol that I would go in and do, and I ended up having to move into a hotel. Anyway, so it's tough, but I went back with this EMDR therapist and was like, okay, let's revisit some of those times where me being so sick has really impacted my nervous system because I know that's part of it. So when I started having the POTS symptoms back, I think my body immediately was like, wow, like this is when we really crashed last time. So I did a lot of focus on that sort of mental and emotional side. I tried a lot of new herbs that were like heart supportive. I think we had texted back and forth and you were telling me some of the ones you were taking. So I ordered all of those. So maybe you can share what I think you had a whole list that you sent me. I took pretty much everything that you sent me.
Yeah, those were things like hawthorn and other things that drain the heart. So, yeah, through like obviously everything that I went through, I was never really focusing on the heart. And now it's like a huge focus, but there's so many different ways to support the heart that we're not taught like from nature that I definitely use now a lot and a lot of homeopathics to work on the heart and just, even it depends what's going on with people because sometimes there's high calcium, so you want to drive it. Sometimes it's different. There's a huge electrolyte imbalance that we've been noticing a lot now too. I definitely learned a lot from this whole experience that I don't think I would have maybe dove into as much had I not suffered through it myself. But I think it's
Absolutely.
empowering because the heart is so scary, right? Like that sense of impending doom, like I know that you had on the plane that
Mhm.
where you
Yeah.
feel like it's over because like you're just like in this like so you already have the actual physiological symptoms going, and just like you said, then you add in the anxiety of I'm gonna die or whatever it is that's going through your brain. Like you're on a plane, you're not in a safe place, right? So
But
learning how to feel safe even on planes was something that I had to learn how to do in order, same as you, to have my career and work and be a highly functioning adult like I already was, right? So I know that fear holds a lot of people back after they have these symptoms. They just don't travel. Like they don't put themselves in the situation anymore. But for me, it was finding ways where I could always support myself, even on a plane. So, for instance, like I knew that I had too much electricity, static electricity, because mold lowers your MSH. You're more conductive. So you can shock more things. So I always traveled with a grounding wire that I could offset some of my onto the plane, some of the electricity. So you can either touch your heel to something metal on the plane, but I had this
yeah.
thing that I could just clip onto something and wear the bracelet and I'd be able to, and I'd feel better. I'd feel calmer. I traveled with a nebulizer and I was nebulizing the oxygen from Cellcore. I started learning that I had to like massage my lymphatics to clear my cardiovascular system, right? So I always had toothpicks on me, but that was from the past, like to tap, because just like people do like the EFT, like tapping, I would use it, make it even more effective to me when I used a toothpick on like acupuncture points, because I do acupuncture.
Wow. Yeah.
So
Which
those type of things. So what are some things that you do to make yourself feel like safer flying now? I know that you're over the hump, but or what are some things you did in the past?
Yeah, it's actually funny because my whole flying protocol is so different now. I used to just be able to hop on a plane and like I was worried if I didn't have a book or if I needed, like, entertainment, and now I'm like, "Okay, let's go through this checklist." I think you're right about electrolytes, that's super important because planes are obviously very dehydrating, and you're breathing that
Mhm.
recycled air the whole time. One thing which I've gotten yelled at a few times, so I hide it until we're, seated, but I have a little air filter that's a necklace, so I bring that on planes, and it has a lithium battery, so I know you're probably not supposed to do that, but
Oh.
bring it on planes with me and turn it on and just, like, filter the air, and I find that really helps.
Mhm.
One thing I have been doing is, there's a Silva method series of meditations that has, like, almost a metronome sound behind it that I find just really calming. There's a deep sleep one that I use at night if I'm, having trouble sleeping, especially if I'm traveling somewhere. Sometimes it's hard to get my body used to being somewhere new. It kinda takes a couple of days. I really love CBD. I would always take CBD with me. Rescue Remedy. There's that ER 911 spray that you can put under your tongue. So that combination of three things I found was really helpful in just making me feel, calm. And also I take GABA. I think GABA is
Yeah.
really great for just feeling that like very chill energy. L-theanine, some of those like adaptogens are really helpful, ashwagandha. And now I've been really interested in the Desbio homeopathics, like you said, because if you're having the heart issues, sometimes it's nice to have a gentle homeopathic. So I really love their mental and emotional remedies. I've right now, and not related to travel, but I've been taking motivation and focus just when I'm like, I think we're similar where we're both high performers and we're both like very, very motivated, high achievers. So the focus and motivation I found is very helpful for people like that. If you're listening and you're a high performer and kind of like used to pushing yourself really hard, those are fun. But yeah, the mental and emotional ones for the plane were helpful. But yeah, I have in my head now, I'm like, anytime, even if I'm taking a road trip, do I have all these things to support my body? Because I know like it sometimes you can slip back into symptoms if your body's stressed. And I don't ever want to go back to where we were before because we were both miserable.
No, it was very terrible, and people are still going through it, and some people can't work through protocols easy because they get big die off and then they get worse symptoms, right? So, we've learned how to like microdose and slowly, but the Desbio supports have been really helpful for Herxine for like that, getting past that emotional side too, but not to mention they have multiple other things that are super helpful. But one of the things that moved the needle that was like magic for me, and I keep talking about it even though it's not widely available, but if people reach out to me, I can guide them to where to get these therapies. But it was an IV of colloidal silver,
Mm,
colloidal gold, colloidal platinum, chromium, some NAD, and I'm telling you, this was one of the things where like I had a clear herx, but then like because I got a fever and everything. But I
yeah.
felt the things like dying that needed to die that were making me have these symptoms. And I went from like, I was still doing better. Like some days I even had a day where I felt 90%, but this was like, it's kept me at a consistent 90% better where right now all I need to do like is get rid of like these rashes sometimes, but I'm very stable. Like that stabilized me like in such like a magical way. So then I've been starting to do like oral gold and oral, like I was already doing colloidal silver, but I feel like these things kill things in a much like cleaner manner than herbs
Mhm.
sometimes. And just to get like the infection side of things down. And then using a lot of like things like augmented NAC to like break down the spike protein, which people are missing as a huge part. And like rosemary to protect from some of the EMFs, because I know that all of that got turned on at the same time as people started having these crazy symptoms.
I know obviously colloidal silver, but can you talk about the gold and platinum? I haven't heard of that before.
I know, because it's honestly kind of, if you look up gold, they make it sound scary, just like they talk online about silver, like you're going to go blue and all of this, which honestly, it's actually quite safe, especially we use the pH structured silver. So you can go very high dose. And that was already something orally that had helped me get over a lot of humps. But gold, oh my gosh, it like makes your immune system tag cancer cells. It regulates your immune system. It turns it back on. It tags other bugs. Like it is like, and like I had a lot of symptoms, like I told you, in my spinal cord.
Mhm.
And that's where I thought I had meningitis when gold was helping me kill off what it killed off. I broke my fever and it was like the biggest weight had been lifted. Like I had no pain. I had no pain in my organs. Like, I mean, I'm talking like magic. Like nothing else has done something like that for me. And so if you look back into like the 18th century, like this is what they used as antibiotics was silver and gold and platinum to turn on people's immune system. And then I started studying silver more and I'm like, oh my gosh, shrinking tumors, like skin cancer, like this and that. And I'm like, this is like being told it's evil.
Mhm.
And like,
Mhm.
if you really look at the risk benefit ratio, there is no risk. The risk is only if you drink like a liter of it a day, which that's when
Right.
people turn blue. And it had like made at home and it had all these bad byproducts on it and it wasn't structured silver like because Desbio was one of the ones like because their silver was part of their kit. That's what opened my eyes at first and I was like, well, why is this? Oh, because it's cleaning up everything if it gets a little messy with the herbs or the homeopathics. And then I just like started learning more and dosing higher and now I'm so comfortable using it. And then I got that high dose in my veins and it only helped me. So I'm just like, yeah, a big advocate for that now.
Yeah, and I love when I lived in the black mold, I had so many really severe sinus issues, which I know a lot of people with mold struggle with. So I was always doing the colloidal silver nasal spray, and you
Nasal
could
spray.
feel it. Like it really works. It really does. And like you said, you can feel it working. It's really amazing. Your body just knows it's helping.
Yeah. So that's a big one. And you can nebulize it too, and you can use it in babies and all of this stuff that like I just didn't know. We had one person, and it wasn't even my patient, but it was just another story that was like an aha kind of moment. They had MRSA in their skin, and the poor baby had to keep going into the hospital and getting it debrided and like they were putting them on multiple antibiotics. Well, topical like nano silver is what healed this so that it didn't become a problem anymore after like multiple very painful interventions on a tiny little baby, you know? So, I mean, it's so powerful and it's so safe. And I'm just like, how are we not like talking about this more?
Yeah. That's one thing I love about you is I feel like you find these sort of protocols because you've had to test them on yourself. And then you really are like, how do I get this information out to more people? Because, you're not afraid to try things that people are saying, this isn't good for us. I just thought of another example when I was the sickest with Lyme. I went to a functional medicine doctor who's a cell core doctor, and he tested me and he put me on ivermectin. This was like pre-COVID, nobody was using ivermectin for anything, but he was like,
Yeah.
"You have a massive strongyloides infection. Like, has nobody ever told you this?" So he put me on ivermectin, and I wasn't walking at the time. Like, when I went to my appointments, I had to call in and ask for a wheelchair, and a nurse would have to come out, get me in the wheelchair, push me in. Um, and so I started this ivermectin, and within a couple of weeks, I was back, walking again. I moved into my own apartment. I moved from California back to Michigan because of the divorce, because of all the mold. It kind of like changed, our personalities, and I was always in the hospital. So we just ended up getting divorced. But, because of being able to take that and some of the other more like functional medicine protocols I went on, I literally a month later, I moved into my own apartment back in Michigan. And I was like,
Yeah.
that's incredible. And I feel like there's a lot of things people are afraid of, like the silver, where we've been told these are scary things, but they're actually things that are getting people their health back.
Yeah, I mean, there was a whole like smear campaign on ivermectin, but ivermectin, that was one of the big needle movers for me for
Yeah.
healing as well. And it was, I think, the same
Mhm.
doctor that put me on it and made me feel comfortable enough because like I trusted them, like that I took something that I really normally wouldn't even be on my radar. And honestly, it was a game changer as well. So yeah, and I think it's humbled me in a way because I think when we're because it was so far away, like it was like 10 years that I hadn't had any symptoms and I'm treating patients and I think I'd lost touch with what it really feels like to be the patient. And I forgot that you need things that work. Like someone can tell you, "Oh, you should only do herbs and natural's the only way." But sometimes like there are certain pharmaceuticals that I stand behind and there's usually
Mhm.
the ones that they're trying to bury that are like these magical things that can really help move the needle. So even for like people with POTS, a lot of these like histamine medications are helping them, right? So, and
Absolutely.
yeah, so time and a place for everything. I think obviously you don't want to be on multiple and overuse them, but something else that happened to me, all of this was I got a severe burn in my esophagus because I had a hiatal hernia from the Lyme, and silver helped me a lot, but I had to take antacids, like H1 blocker, right? Like I had to take Pepsid AC because if not, my stomach acid was coming up and burning more of a hole in my esophagus. And because I had this predetermined thing that that's so bad and you need stomach acid, guess what? When you have severe histamine, sometimes you do have too high of stomach acid. So if people
Right.
don't want to hear that, that is the true story. And sometimes it's making too much at night and coming up and burning your insides. So sometimes you need these things that
Ye
can really help you and actually save your life and save you from a hole in your esophagus. So I think time and a place, learning and being open. The biggest problem with our healthcare, with natural and with conventional, is that we're not communicating with each other. And there's really good things on both sides that could really help people.
Yeah, and it really depends on the person, what they're going through, what their root causes are, like, what
Yeah.
have they tried in the past? It's such a puzzle, and that's why it's so great to have, practitioners like you who are you've been through it and you're willing to sit there and be like, "Look, like I'm not saying all one side, all the other side. Like we have to look at all the pieces and see what's a great fit for people because I mean, that's the kind of care I wanted when I was sick and it was really hard for me to find because everyone has their protocols that they know and they trust and that sometimes they're not necessarily willing to go outside of the box or try something that maybe is demonized in even in functional medicine,
Yeah.
like you're kind of exploring both sides to see what we can really get to heal this person. And I think a lot of us who have been sick don't even remember what it feels like to be well, so sometimes we're just okay with like maybe I'm 50% better, but I've been so much worse, so I'm happy to just stay here. Like, I remember that was a big thing when I was working on the Lyme, the herxes were so severe that I was like, "Do I really wanna put my body through this for 9 months, or am I okay, like, functioning at 50%, knowing that I've been at, like, 10% before?" And now that I'm, almost all the way healed, I would say, like, I would just encourage people to keep pushing and keep moving through it because living your life at 50% and just being okay with it, you shouldn't have to do that. Like, you can heal, you just need
Yeah.
someone who can look
Yeah.
at both sides and can pull in the right protocol for you.
Yeah. And even like, so one of our values at Vegas Clinic is like being non-dogmatic, right? Just always finding out what's best for the person that you're working with and like listening always to other people of what have helped them. What has moved the needle? Oh my gosh, this one person, like I said, this antihistamine like changed their life. Okay, this person has similar symptoms. Like, do we have an MD that can try that when they're suffering like crazy? Why, who am I to be like, no, just keep suffering through on this
Right.
protocol, even though this natural antihistamine is not doing anything for you? And then we see like this miraculous healing for them too. And then I just did another podcast with someone who was going through similar symptoms to us, and microdosing a GLP-1 is like
Mhm.
move the needle for them. So like I'm listening. I want to know what works for someone, and then I want to help them do it and use it safely, always at the lowest therapeutic dose that we can, and really communicate with them so we can know if something is not good for that person or not. But I think if we communicated more like that and more people were talking to each other and we were speaking the same language, then we could help a lot more people and we could see what actually works, moves the needle, what is the right person for thing for right one person and not the right thing for another. So we can't get there though if we don't have people open.
Absolutely. Yeah. And I'm excited about your podcast in general, just in hearing people's stories and, talking to people to see what's worked for them because it's a very lonely life when you're sick. I mean, you don't know who to talk to because nobody really understands. And that's why I think like you and I had texted a lot because we were like, you're the only person I knew that had any symptom like I've ever had. So I was always like, hey, did you experience this? Did you try anything for this? And so I think it's great to have a platform where people can just share like what's worked, what hasn't worked, how they're feeling about it because, it can be very lonely trying to heal. And even like if you have, a practitioner, it usually takes people a while to find the right person. So sometimes you just feel like you're on your own trying to figure it out. So I'm really happy that you're doing this.
Yeah, thank you. And I know I was reaching out to you being like, how are you doing now? What did you do for the, because again,
Yeah.
that's the interest because I have other people that some of the things that worked for me wasn't moving the needle for them, but then maybe some of the things that worked for you would move the needle for them. So, it's just like so important. And there are great practitioners, but sometimes they do get stuck in their exact thing. So, just always, even like the way to communicate to practitioners, I think, like, because if I work with people, being like even more able to help them, being like, maybe I heard about this. So if you're listening to this podcast and you want to go to your practitioner and you're like, you know, not being like, I want to try this. Why aren't you doing that? Like, just because everyone's trying to help you and they're just sometimes people are just doing the best that they can. But if you bring things up to people in a gentle way, they're more less likely to become defensive and think that you're saying they don't know something because people have their
Absolutely.
ego and their pride. So just like
Absolutely.
always keeping that in mind when you're also.
Yeah, and there's also a great book I read recently. Actually, my ex recommended it to me while we were dating, but it's called Nonviolent Communication, and it was life-changing for me and just knowing how to, like, present information to people without creating that defensiveness, how to word things. I have a whole, like, protocol sort of you can follow. You put your words in here and, like, here's why. So that's a
Oh,
really great book if anyone's looking. I don't know, like, I used to be pretty straightforward and blunt with things, and I feel like that book has been really helpful in just knowing, like, if I was a patient and I wanted to bring something up to a practitioner, I wouldn't be like, "Hey, why aren't we doing this?" There's a whole way you can
yeah.
go about it to say, like, "Hey, have you, had any patients who've tried this?" And it's a really great book if you're looking for a way to approach a practitioner and
That
ask, some
that sounds
questions.
amazing. I want to read that
It's
book as
great.
well.
It changed the entire way I communicate. It's an amazing book.
Yeah, I've never been actually that's not true. I am super blunt in some ways and then but I do feel like I have learned a lot of how and even when you're really new into something and you're so passionate about it that you're passionate like kind of blinds you. Like I feel like that's like newer practitioners sometimes too. So it's just yeah, like you become humbled the more you practice. It's the same thing when I was a manual practitioner. Like some days I'm like, oh, I'm just fixing everyone. And I'm like,
Yeah.
some days you're like, "Oh, why don't can't I figure this out?" Like, it's just it's something all practitioners struggle with because like I said, you could have this magical breakthrough for someone that works better with you because like there's a lot of communication. Then you can have like them another person with the same symptoms on the exact same similar things based on
Right.
their and they're not moving the needle. So it's just very humbling working with human beings with so many
Totally.
layers. So, some people need a lot of the primal trust and some people need less and some people need something. So it's just deciphering that is I think an art that comes with time more so than a science.
Absolutely. There's a lot of components to that, yeah, and then when you find the right person who's willing to listen and kinda work with you and a collaboration, I think that's also really beautiful too, having that two-way communication with a practitioner is really great.
Yeah. Didn't you work a bit with Dr. Motley as well?
Yeah, I did. He's great. I feel
Yeah.
like every time he speaks on something, everyone just feels his energy, like, he's just
Yeah,
such a good energy person
he
that
really
really comes
is.
across, yeah. So, yeah, and it's interesting, I think we were talking about, there's a lot of products that I've been focusing on recently just because like, my health issues are pretty much gone, but now I'm looking at those things where it's like, how do I become a better human? How do I become like someone where
Uh-huh.
you walk in the room and they're like, wow, her energy is just so positive. So I've been doing a lot of kind of that work with like Kundalini yoga and different, therapies. Like I said, EMDR has probably helped me the most, but just like how do we elevate, like looking at the emotional guidance scale. I find that so fascinating. How do we move
Mhm.
up that scale? And so that's been fun to learn about and to look into too now that I'm feeling a lot better.
That's amazing. Yeah, it's like a progress and now it's like, how do I never have that happen again? How do I elevate above? And I
Yeah.
don't know for you because you're talking about now like creating this better energy because I feel like when all of these infections turn on in the body and that's what I think is happening. COVID allows these infections that are stealth in our body that some have more than others, some have more toxicity than others. Turns on these symptom patterns. Like, I don't know about you, but like when I was feeling that bad, like I felt like cut off from like my higher power, from like that
Oh, yeah.
energy, that magical feeling that I have had in the past. And like that's only where I'm getting to now. So it's like, it's layers of things.
Yeah. It's hard because I feel like all you're focusing on is your physical health at that point. You can't think about elevating up this scale because you're literally so sick that you're like, how am I going to survive? I remember when I was at my lowest, I would wake up in the morning and be like, I already feel so toxic. I already feel like
Yeah.
absolutely awful. And you just know there's alarm bells going off in your head where it's like, your body knows something is severely wrong. And it's not just like a cold. It's not just something where you're like, well, I'll get over it in a week or two. So you
No.
can't, like, you don't have the capacity to focus on anything else. So that's the best part about healing is like once you get to a certain level physically, you can really start to build in that emotional support, the mental support, the like I love the
Hmm.
word that you used, elevation. How do you get
Hmm.
above that and become like a better human, a safer human
Hmm.
with more capacity to deal with things? But you can't. And if you're in that phase and you're listening and you're still really sick and wondering how you're gonna get through the day, it does get better. I mean, obviously, Dr. Canestraro and I are both examples of that because we both have been very, very sick. And I feel like now we're both doing quite a bit better. We're able to help other people, which I think has been important for me in having a purpose and working with practitioners because I know that their avatar was me at one point. So I know how to speak to them in a loving and a
Hmm.
safe way because when I was sick, I just wanted to feel seen. I felt so misunderstood. I felt so unseen. I felt like no one was taking the time to really like listen to my symptoms because a lot of doctors are like, okay, like 20 minutes, like let's go, tell me the basics. But it's been really beautiful for me to be able to come back and work with practitioners in that way and just, encourage people who are sick to keep going and that it does get better. And you just have to have the right tools in the right order for your body and find the right practitioner to work with, but it does get better and your life gets better and you can start worrying about some of those fun things like,
Hmm.
healing old traumas and trying to
Yeah.
elevate yourself higher.
Yeah. And
Mhm.
I just want to note too, because, I said I had magical kind of healing with that IV, but I had done a million things before then. So I've been seeing a lot of people like trying to market one thing, being like, I threw out all my other supplements and I'm just using this because this is what did it after I spent hundreds of thousands. And I was like, what about if maybe it was all built up from those other hundred of thousands and this was just the thing that
Totally.
took you over the edge? Like, I know some people who are saying like this certain detox did everything. And meanwhile, they had another medical intervention where they had to have a major surgery to help something else, but that's never talked about, like, and you're like,
I
no,
can
okay, there's so many things. These are complex chronic problems and there's layers. So
so
also just keep that in mind as you work through these things.
absolutely, yeah, and there's so many pieces for me too, like, I had to go get all my root canals removed. I
I
had a
still have
titanium.
one. I need to
Girl,
get it out.
that was a big thing for me too,
Can you
like, I had
tell
a
me
tit
who did it? Can you tell me
it was
who
in
got?
California. I can message you though.
Okay.
Yeah.
Okay, perfect.
Yeah. Mhm. Yep.
Because I
Yeah.
keep finding the person to get mine out, and then it's like, it doesn't work out for some reason, or like I'm so
Mhm.
nervous and I hear one bad thing about that, and I'm like, "Oh, I can't go to that person," because I want it to be like root canal out and then post put directly in, that's ceramic.
That's what I
Is that what?
did. That's
Okay.
exactly what I did, and he
Oh my
did
god,
ozone.
this is yeah.
Yeah, he cleaned everything out with ozone. I had a great experience. It was a little pricey, but I'm like, it's worth it, you know?
Oh, I know it's pricey because then I was gonna go to Germany to do it, and then it's very pricey because then it's in the euro and it's also over there and I'm in
Yeah.
Canada. So anyways,
Mhm.
regardless, we'll chat after, but
Yeah.
I know we had a little rocky start because of my internet and stuff, but I know you have a tight stop. So I just want to say thank you for being here, but I also want you to be able to tell everyone where they can find you because I know sooner you have a practitioner archetype, and I know some practitioners are listening right now. And I know that you have a patient one coming out. So can you talk a little bit about that
Yeah,
and then we can.
absolutely. Yeah. So my website is just upsellhealth.com and you'll be able to find both if you're a practitioner or a patient. We just launched our practitioner archetype, which if you think of the Enneagram, it's basically like the Enneagram for practitioners. You take a short quiz, there's 15 results. It'll tell you, if you're a rebel disruptor or are you a healer's healer? There's all these different archetypes. And it's based on your fears, your motivations, everything about what you believe as a practitioner. So you'll get that. There's a free report that you can download, and there's all of these tips on marketing. So if you're a certain way, what are the best platforms for you? What are the best places to be? How should your voice be? So it's all of these trainings. And then what we're working on launching is the patient archetype. So what type of patient are you? Just because when I was sick, I could never find a good fit for me, both personality wise, belief wise. What do they focus on? It was really, really difficult. So we'll have a quiz that patients can take, and it'll tell them what kind of practitioners are a great match. So if you're a data-driven practitioner, you're probably not going to pair well with a patient who's more of like the mystic cosmic. They want like the mental emotional. It's just not a good fit. And
Mhm.
everyone can be a good fit, but it just kind of gives you some tips on, on that. Yeah, if you just check out upsellhealth.com, you'll find all of that. And then I'll eventually create a matching system where you'll be able to find practitioners who specialize in what you like, mold, Lyme, whatever you have, and they're a good fit for your archetypes too.
That's so cool. I'm really excited for that. I
Yeah.
gotta do my practitioner
I'll
archetype
send it to
right
you.
after I get this. Yeah,
Yeah.
okay, awesome.
Awesome.
Okay, well, thank you so, so much again for sharing your story, for being vulnerable. I know you went through a lot and we didn't even get to go into all of the nitty-gritty on it, but
Mhm.
if people can always reach out to you. But I'm glad you're doing better and I'm
Yeah,
glad that you're elevating now and it's just great to see you
you
shine.
too. Yeah, you too. Thank you so much for having me.
Thank you.